Hey everyone, and welcome to your introduction to the vista of nursing, where we'll look at where nursing began, where it's going, and what it really means to be a nurse today. Let's dive in. A quick trip through history. In ancient times up to about 1000 AD, nursing was mostly done by families and priests. Women started studying midwifery in Salerno, Italy, and Christian convents trained people to care for the sick. Fun fact: deaconesses were basically the first public health nurses. Fast forward to the 18th and 19th centuries, and we get the serigamps. These were untrained, lower-class women who looked after the sick, not exactly the most professional image of nursing. The rise of modern nursing. 1836. The first official school of nursing was founded in Kaiserwerth, Germany, by Pastor Theodore Fliedner. And then came Florence Nightingale, who changed everything. She's known as the first nursing theorist and opened the famous Nightingale School of Nursing. By the early 1900s, all states started requiring nurse licensure, and in 1892, the Young Women's Christian Association, or YWCA, opened the first training program for practical nurses in NYC. It was only 3 months long and focused on caring for the sick and running a household. Women who shaped nursing. Let's give a shout out to some legendary nurses. Clara Barton, known as the Angel of the Battlefield and the first president of what became the American Red Cross. Dorothea Dix, mental health care reformer. Mary Money, first African American nurse in the US. Linda Richards, first trained nurse in the US and creator of Modern Nurse's Notes. Isabel Hampton Robb pushed for licensure exams and nurse registration, and many others who helped shape community health and nursing education. You've got options: LPN, ALVN, 9 months to 2 years, licensure, NC, LEXBN, ADN, associate degree nurse, about 2 years, licensure, NC, LEXRN, diploma nurse, hospital-based programs, licensure, NC, LEXRN, BSN, bachelor's degree nurse, 4-year university program, licensure, NC, LEXRN, and from there, you can go even further. Advanced nursing education. Want to level up? MSN, master's degree. Choose roles like nurse practitioner, midwife, educator, or CRNA. Doctorate, PhD or DNP. Become a researcher, university dean, or director of nursing. Nursing isn't just a job, it's a career with ladders you can climb. Nurse Practice Act and scope of practice. Each state has a Nurse Practice Act, a law that spells out what you can and can't do as a nurse based on your training. For LPNS, that usually means practicing under the supervision of an RN or a physician. The Board of Nursing in each state enforces this, and it's your job to know it inside and out. Why? Because your license and patient safety depends on it. Career ladders. Want to grow? You can. Start as an LPN, then transition to an RN. Go from LPN to ADN, or ADN to BSN. Use your past credits to move up without starting from scratch. Stay curious. Keep climbing. Lifelong learning. Nurses never stop learning. You're due. Degree programs, continuing education, seminars and short courses. Medicine changes fast, so we keep up. Specializing as a nurse, you're not stuck in one area. Nurses work in critical care, pediatrics, med-surg, maternity, offices, homes, long-term care, and more. Key traits of great nurses. Here's what makes a nurse great: caring, honest, organized, observant, responsible. You'll care for multiple patients, help their families, notice when something's off, think critically, and always speak up when needed. The heart of nursing. Dr. John Watson's theory of caring. According to Dr. John Watson, caring is at the core of nursing. That means listening, showing empathy, touching lives literally and figuratively. Don't get lost in the charting and the treatments. Remember, you're caring for a person, not a diagnosis. Professionalism in nursing. Professionalism matters big time. That means showing up with the right attitude, appearance, and communication skills. And it also means steering clear of drug diversion, neglect, criminal behavior. Professional conduct is part of the job description. Nursing organizations. These groups give nurses a voice in policymaking and law. HOSA, Health Occupations Students of America. NALPN, National Association of Licensed Practical Nurses, joining one. Smart move. Also, remember, if you delegate a task to a CNA or aide, you must know what's in their scope too. If you assign something unsafe, both of you are at risk. Nursing theories and trends. Nursing isn't guesswork, it's backed by theory. Theories explain what nursing is and how we care. They shape education, practice, and research. And today, we focus on evidence-based practice and quality care. Thanks to the QSEN initiative, new nurses are trained in 6 areas: patient-centered care, teamwork, evidence-based practice, quality improvement, safety, informatics. Final thought: nurses are the eyes and ears of the healthcare system 24/7. You'll form bonds with patients, advocate for them, and often be the first to notice when something's wrong. So ask yourself, are you ready to become the nurse who makes that difference?